That's right. First, Ron, we get to talk about a very pleasant subject, colds, bronchitis, the flu. We have Dr. Denitza Blagev here from Intermountain Medical Center to tell us the difference between the three. A cold, what are the symptoms of a cold?
So the common cold usually we think of as something that's caused by a virus. It's self-limited. It lasts about a week or so.
Okay. You just treat the symptoms.
Exactly.
Right?
Just supportive care. And typically people have a runny nose, they'll be a little bit tired, maybe a cough, maybe more run down.
Okay, can a cold turn into bronchitis?
Yeah, and rather than thinking of it as turning into bronchitis, having a cold essentially can predispose you to developing a bacterial infection on top of it. So when we think of the analogy of skin, so if you have skin that's intact, that protects you from getting bacteria into the blood, but if you cut the skin, then you're more susceptible.
Okay.
Well, having a virus in your airways roughs up the airways so that some of the natural defenses you have against infections are now a little bit dampened, and so you are more susceptible to potentially getting a secondary infection.
What a great analogy with the skin. Okay, and then what about pneumonia?
So pneumonia then is really an infection of the lung, and you know, sometimes we get confused because you can have a bad influenza pneumonia, meaning like the flu can give you a pneumonia because it causes so much lung damage and inflammation. Pneumonia is typically something that really will require more therapy, and if somebody has a cold and it's not going away in a week or two, then that usually warrants some more thought about it. If people are having severe fevers or severe shortness of breath, or a lot of pain every time they take a deep breath, those are things that typically would would be advisable to see a physician for.
Okay, and then with pneumonia, you need an antibiotic.
And sometimes, you know, as I said, even influenza can cause pneumonia, so sometimes it's antivirals too, but pneumonia is typically something we want to evaluate and treat because it has a pretty significant complication rate, and people can really suffer.
Well, there are a lot of illnesses going around. When should you take your kid, or when should you go to the doctor?
One of the things is really severity of symptoms. So if somebody already has some lung problem and then they're severely short of breath, then they need to be evaluated. Okay. So if it's severe enough, it doesn't matter how long it's been going on, it needs to be evaluated. But if the symptoms feel like a regular cold, then I would give it about a week and see if things are getting better. And if in a week they're better but not quite perfectly resolved, then at least you know you're over the worst of it and you're in the right direction. If you're getting worse and worse and worse, and you're having fevers, you're coughing up more stuff, if things are going the wrong way, then I would be seen.
Dr. Blagev, thanks so much. Some great advice. 'Tis the season.
Yeah,
we'll be right back. Stay with us.